Hey everybody, this is Dr. Vishnu from the American Acupuncture Academy. I wanted to spend a couple of minutes today to talk about something really important, pretty basic to anybody that goes to see an acupuncturist, and how that might relate to a better experience for you and a more complete understanding about what happens and why. The initial intake and diagnostic from any licensed acupuncturist in the United States comes into a couple of real important factors. They talk about they're going to feel your pulse, and they're going to look at your tongue. So when someone asks you to stick your tongue out like ah and hold it out for a moment or so, there's a reason for that. The reason for that is there are 54 different kinds or qualities of tongue. The body, the color, the coating. Is it dry? Is it wet? Is it red? Is it pale? Is the coating white? Is there no coating? Is it dry again? Or is it thick yellow coating? Or is it a thick white coating? Are there cracks, or is it mapped? Are there scallops on the sides of the tongue? These are all indicators of what's going on inside the body. Why? Because the tongue is the litmus paper of the body. It represents all the internal organs, and that's why it's important to look at the tongue. As a practitioner, you get a lot of great value from understanding what's going on inside of a person when you have a chance to look at their tongue. It reveals that which they may not communicate to you about. Some of the state of the spleen, the state of the liver, the nature of the heart. So things, every part of the tongue is a reflection of the organs. The middle of the tongue relates to the stomach, digestion. The tip of the tongue, the heart. The back root of the tongue is your kidneys. The sides of the tongue relate to your liver. And again, if how that reflects and manifests in the state of your health will help the practitioner determine the best approach to help you with your issues in terms of two things. If they do herbs, what particular kind of herbal formulation will help to either cool things down, warm things up, moisten things that are dry, or dry things out. Secondly, you can also see the tongue as along with the pulse, which we'll get back into with a follow-up conversation here shortly. But the big thing is when someone sticks your tongue out to the practitioner, they do it not to be rude, but to actually give indicators internally about the organs, state of the organs. Are they? Is it quivering? Sometimes if you have a wind invasion or the liver's disturbed, you won't hold your tongue still. It'll quiver. Or is the tongue bent to one side versus the other side? Some people have a hard time projecting out the tongue. It stays retracted. So that is indicative of a particular kind of a syndrome or other level of imbalance. So these are some really important things that you want to look at, and feel free to ask questions. You can email us at a3acupuncture.com, or else you can email me directly at the numeral 1 ACUDOC, that's 1 AcuDoc at gmail.com, or call us at the office 352-729-4361. Thanks for listening, and stay tuned for the short video we'll put out on the pulses and why they're important. Have a good day.